Well, we've always had opioid stewardship efforts to make sure that we're using medications appropriately at hospital for special surgery, but our more formal efforts really began here in 2016 with generalized prescriber education. We, that year, made sure that every single prescriber at the hospital, all the doctors, all the physician's assistants, all the nurse practitioners, and then eventually all of the staff went through training programs, which subsequently then became a requirement in New York State and even federally. And we continue to do that on an ongoing basis to make sure that everyone has at least the basics of understanding how to properly prescribe and how to properly taper and how to properly store and how to properly treat problems with opioids, even if that's not your primary specialty. We developed a number of tools that are now embedded in our electronic medical record system in order to help the providers understand the relative potency of the medicines that they're prescribing, to give them access to tools that allow them to help their patients to taper off medications. And most importantly here, I think we have a novel service, which is a preoperative pain evaluation service. So for patients who are planning to have an elective surgery at hospital for special surgery, who have had a problem with pain control after an operation, who have other risk factors that make it difficult sometimes to control their pain, like addiction to opioids, or who have been on opioids chronically for other reasons, those patients will be referred by their surgeon for preoperative evaluation, and we can speak with their provider, we can have a better understanding of what their goals are, and we can make a plan for them so that when they do come to the hospital for their surgery, we're not only aware of the things that may not have gone well the last time, but we could do better, but we have a safe program for them which will allow them to have their surgery, rehabilitate from their surgery, and then at least get back to their prior state and hopefully even better than their prior state. Initially, the most important thing that we wanted to do, in addition to educating our providers, was to make sure that we were standardizing the way in which opioid pain medications were being prescribed after surgery, and then sought to understand what medications people were actually using. We do a lot of surgery here. We tend to do a lot of similar surgeries, so it's easy to look back and see what people actually require, how their pain is afterwards, how do they rehabilitate. And we found that actually we were able to significantly reduce the number of pills, now on the order of about 1 million pills per year, without worsening anybody's pain scale, in fact improving their satisfaction scores and improving our outcomes. We have, in patients who've been through our preoperative pain evaluation treatment service, we have reduced their length of stay. We've improved their surgical outcomes. Well, we're going to continue to look at ways going forward to improve our anesthetic techniques, ways going forward to use adjunct medicines, which are things that are not opioids that also relieve pain, to reduce the amount of exposure that people have when they need opioids for a surgical procedure. We're experimenting with some of those novel medications now. Some of them are cannabinoid medications. We have now a large critical mass of research within the anesthesia department and the pain management division at Hospital for Special Surgery, and most of those efforts are directed towards exactly this problem, which is how to get people better pain control that's safer, and safer means with less opioids if possible.